Today I'm joined with medical doctor, Dr. Smith. We're going to do some questions and answers with this brilliant gentleman about this water machine. So I know in your past you didn't really get excited about this water. You weren't recommending it to people, and something changed. Can you tell us a little bit about that story?
Well, you see patients come in and they tell you stuff, and you can learn things from the medical journal. And if you're smart, one of my best mentors was Dr. Corrado, and he said, listen to patients. And patient after patient would tell me, I got better when I was on this alkaline water, Kangen water. I'm not sure how it works, but it must be doing something. And then I actually studied a little bit about how the machine works, and its various phases. You can do different things with different settings. In fact, sometimes you don't want alkaline water. You want acid water to do a job, like to kill a virus or a bacteria. Then you need alkaline water to sort of calm everything back down again. So you have a machine that can both sterilize and then clean and then repair. And we use supplements, and you have to purchase those. But the water acts very much like multiple different supplements, depending on how you set the machine. You've got a sterilizer, you've got an antioxidant, you've got a cleaner. You can do all these things with one machine, and you don't have to pay for it over and over again.
That is a good point. Now, what would you tell somebody that was more skeptical and they are drinking a lot of tap water? Maybe they don't even drink a lot of water in general. How would you get around this being skeptical over this water?
Well, the simplest thing is go look at what's in your water, and if you get a report, find out what's in there. And if you get that, you should be pretty scared about drinking that. I wouldn't drink. I don't drink tap water.
Good.
Unless I absolutely have to. But
right. And I know you've done a lot of research on this water, and you can go on PubMed. You can pull up thousands of articles.
Yeah, I just pulled what's hydrogen water. So I usually expect to see Mary's blog. Here's all the good things about this hydrogen water. So I use PubMed. So what's on PubMed? That's the official government where are studies published. These are scientific studies, and they're peer reviewed, and they're on PubMed. So the first one I looked at was the effect of hydrogen water on patients getting radiation therapy. And they were looking at their quality of life when they're on the hydrogen water versus the controls. And the quality of life was considerably better on those getting the hydrogen water. Why? Because ionizing radiation is about the most oxidizing thing you can do, and it causes a lot of peripheral damage. And so the hydrogen water came in and just repaired all the other stuff and the collateral damage, if you will, because it's pretty hard just to focus just right on the cancer cell. There's a lot of other damage that gets done, and the hydrogen water was able to, neutralize that. And it's in fact, if you go to PubMed.gov and put in benefits of hydrogen water, I think it's the first article that come up. It's pretty long, and it's a lot of technical data, but you can see it's a well-studied document.
So the people that are skeptical, they need to research it, because there is so much science that backs hydrogen up and how this water works.
That's right.
And so what about, you see people with those little pills that you can put in your water that make hydrogen water. Then you have the recurring expense of all those, and then taste that's really not good. So tell us the benefit of why you'd want this in your water and have your water filtered, and then have the opportunity to have this unit with all the different waters versus just buying that.
Yeah, I showed you some today. It's a magnesium compound that you put in the water, and it creates the hydrogen. You have to put it in there, seal it, and sort of let it bubble up, and then you've got hydrogen water. The one I have doesn't taste that bad, but I have tasted other companies. This has sort of been coming of age in the last few years. You go to a conference, and all these vendors, and they sell these, hydrogen water, just like you'd get, a nutritional thing, a drink. And so I got some, and I opened one bottle of it. I couldn't finish even one bottle of it. It was so horrible. So it doesn't have to be horrible, but it doesn't taste anything like the water you're getting out of one of these machines. But it's just due to the concentration of the water and how much they have to put into it, and how they keep it. I mean, hydrogen water doesn't keep very well. once you open it, it starts oxidizing because that's what and works as an antioxidant, so it's doing its job, so it dissipates pretty quickly. So the best way to do it is generate it on the spot.
Awesome, good. And now talk about this antioxidant versus the food-based antioxidants and the differences.
Well, they're food-based you need lots of different kinds of antioxidants. We know that if you give just one antioxidant, there have been several studies on lung cancer, like vitamin A or beta carotene. You just gave high doses of that one, actually increased the cancer rate. So the way this works is you have a hot electron and then you hand it down like a staircase. So it generally loses its charge. But if you have a missing step, then all the electrons accumulate there, and that antioxidant becomes an oxidant. So you need different ones. So that's what the plants do, and that's why they're usually given in chains, different things, so you can move that electron down. But hydrogen is the universal donor because you're taking hydroxyl, which is our main free radical, and turning it into water. And the beauty of that is it goes everywhere because it's a tiny little molecule. It can get in the brain. Some of our antioxidants don't get in the brain. We have to give precursors and we have to make them in the brain, sort of mix them up there. But hydrogen goes everywhere. And so one of the other articles was on brain trauma, post-traumatic stress and concussions. Hydrogen gets in there and does a job.
Wow, that's awesome. One of the funniest things ever is when people start drinking this water, because the hydrogen finds a free radical and turns it into water, your body excretes the water out. And so the more toxic you are at the beginning, the more you're going to the restroom. And I tell people the solution to pollution is dilution. You got to get it in to get it out. And so if you do drink this water and you start experiencing that you need to go to the bathroom rapidly, it's all those free radicals getting out of your systems. Your body's cleaner and it's more detoxed.
Yeah, toxins get trapped. They get trapped in cells that can't get out, and because there's charges around them. There's a whole syndrome called CRPS where people have a sprain on their ankle and they have excruciating 9-level pain and it doesn't go away. It's because those toxins are trapped. So one of the things that you may experience when you start using this water, you don't want to start using it full bore because we have what's called a Herxheimer reaction, and that's when you've got this body full of toxins and you want to get rid of them, and you take all this stuff and you start getting rid of them, but they sort of hit you on the way out, so you feel like you got the flu. It's totally preventable just by going slow. But if you do something like experience like that's a good thing because you know that this is working. You can feel those toxins that they're going out, and then we give people IVs. We say the best thing that happens is you'll feel bad because when we know we've probably removed too many toxins too fast. But that's a good sign. We just have to slow it down, but we know it's working.
Yes, and that's one of the mistakes I made at the beginning is I gave a lot of people the highest level, not realizing the true benefits of this water, what it can really do. And I've seen people from years ago that come to me and they're like, oh man, that's that water. I remember you gave me that several years back and it made me extremely sick. Or they got a headache, or they had to rush to the bathroom. I know we can store, how many pounds of fecal matter can we store in our colon?
I don't know, but I had one lady that came in. She had one bowel movement a month.
Wow. I had my first colonoscopy when I was 21, and it would be a week before I go to the bathroom.
Oh, wow.
And then when I did, I'd have blood in my stools, and I was put on stool softeners. And when I got the water machine, I was like, wow, what a relief this is to my body.
Oh, yeah.
And I know just from learning from all the doctors throughout the years, Dr. Shinya, who developed the polypectamine and co-invented the colonoscopy, he has a book called The Enzyme Factor. And he talks about if you're not going to the bathroom once or twice a day, you have yeast, bacteria, funguses that are feeding on that fecal matter. And then there's a waste from their body that leaves its waste inside of our body that leads to disease of all types.
Oh, sure. Yeah.
And can you speak on that at all?
It's just like a little brewery down there.
Right. So what are some of these symptoms that people get from not having proper digestion?
Well, bloating probably is the one, and fatigue, especially after eating, gas, and constipation. The colon requires butyrate to run, and if they don't have enough of that, they get low on energy. But the big one comes actually not in the colon, but in the small bowel. where it gets leaking, and then they get autoimmune disease because the membranes break down and the food and bacteria and whatever particles get into the blood. And then if you have tissue that looks similar to those, the body will attack that. Like Yersinia, for example, that was the bug that caused the plague. In Europe, we have a form of it in our gut. And the number one cause of thyroiditis is leaky gut. They see the Yersinia, and the thyroid looks like the Yersinia, so you get that. So if you treat the Yersinia allergy, the thyroiditis goes away. And then same thing for a rheumatoid, Proteus and Klebsiella. Those bugs are associated with rheumatoid arthritis, all coming from a leaky gut. So if you can stop the leaky gut and keep the bacteria where they belong, you're going to solve a lot of the problems rather than having to give drugs that cost $3,000 and knock out part of your immune system to get rid of the autoimmune problem.
Let's talk about acid reflux. I know I've seen so many people out the years, and there is one clinical study on PubMed that talks about alkaline water being a huge benefit to people that have acid reflux. Many years ago, I remember I had a lady that used to go to Costco, and she'd buy a huge Tums container, and she would go through that once a week, the huge container. And she would actually make the remark that before this water, she would remember burping up fecal matter. It would get that bad. After being a month on the water, she lost tremendous amounts of weight, mostly due to all the waste that was being eliminated. But talk about these acid reflux drugs and what they're doing to people.
Well, if you read the fine print, most of them have a warning not to be on them for more than about a month. I was impressed. There's free seminars they send it, you can go to, and so they were talking about these H2 blockers, but we're talking about to control the acid. They basically destroy the pump. So I asked the question, how long should people be on these proton pump inhibitors, given that the FDA says you should only be on them for about a month? Oh, forever. No wonder they were free. And every subject in there had a drug associated with it that you would take forever, which is the way Big Pharma makes their money, is keeping people chronically ill and covering up the symptoms. So that acid is necessary to absorb B12. So you're on those drugs for a long time, Alzheimer's.
Really? Because that's B12.
Well, and not just necessarily directly B12, but there's an association between those drugs and increased risk of Alzheimer's and some other diseases as well. Wow. So, we're supposed to make acid. So blocking the acid is blocking the absorption of B12. It's blocking the breakdown of proteins. Okay, most people don't make enough acid, which seems like, well, that doesn't make sense. Why would it have? Well, why do we eat salad? Well, bitters, it causes the secretion of stomach acid. So you eat that, and your stomach sort of works like your toilet. When you flush the toilet, the water goes down, and then the valve shuts, and then the water comes up, and when it hits the top, the float goes up, and the water stops going in there. Well, your stomach works the same way, but if you don't have enough acid in there, the pump's sitting there, drip, 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 drip. And so no wonder you have reflux,
right? Because
you can't turn off the pump. So when we're treating it, if we're treating it with a supplement, we would give them acid. So that they have, with their food, so they have enough acid to digest their food and then shut off the pump. Well, I was reading the brochure on digestive stuff. They just give them the acid in the water.
Yes. Yes, and so...
You're killing my sales.
Right, because there's a certain water you take with your meals to help with absorption, digestion, add more acid. And it's a misnomer. A lot of people believe that they should drink a lot of water with their meals so that's going to keep them full. But what it's actually doing, it's diluting all that stomach acid, and your body has to work harder to create more stomach acid so it can properly break down the valve and close that valve. So now you have more alkalinity in there. It's not killing all the bacteria, you're not creating enough acid, and your body is not absorbing your nutrients. So I always tell them the best time to drink this water or any water is 30 minutes before you eat and 30 minutes after you eat. When you're eating, you should be eating and not drinking a lot of liquid because it's diluting your stomach acid.
That's right. I mean, you have all these enzymes in there. So you get the acid, then as soon as it leaves the stomach, it goes to the duodenum, and all these bile and pancreatic enzymes are added. And then if you add all this water to it, you're just diluting the effect of those enzymes, and so they're less effective. And it's perhaps why we see malabsorption so prevalent. I mean, we do these studies that look at nutritional levels in people. It's rare to see anybody that passes. In 100, maybe 2. And most of them are atrocious. Well, they don't have enough enzymes in there. And if they're drinking a lot of water with that, they're diluting what they have down further. So they just don't absorb it. The last lady, she was taking $300 worth of supplements, and she flunked everything. I mean, you've got a green, yellow, and a red. She was, virtually everything was in the red.
And water transports nutrients too. So if she's taking this $300 worth of supplements, water is what brings it into the cells, helps your body use it, and then of course helps your body eliminate the waste. So if you don't have proper water going in that's hydrating you, it's not going to get fully absorbed either. So she might be just flushing expensive urine down the toilet.
Oh, it doesn't get to urine.
Oh, really?
It gets to poop. It doesn't get absorbed.
Wow. Oh,
you got to absorb it to get to urine.
Wow, interesting. Wow. Amazing. So thank you so much for all the knowledge that you're sharing with me today. I did have one other question for you about dehydration. When people come to you, what's the main symptom they're experiencing if they don't have enough water in their body?
Yeah, I'm thinking about that. Most people don't have enough water in their body. The one easy way to tell if you have enough water is look at your urine. If you got dark, heavy urine, you're dehydrated. And thirst is not always the greatest indicator because it sort of lags a little bit. But I just ask them how much water they're drinking, and if they're hurting, if they've got a lot of aches and pains, typically they're a little bit dehydrated.
And I usually recommend or tell people a half an ounce per pound of body weight per day minimum, and they can go all the way up to 3/4 of an ounce or even an ounce as long as they're taking good quality minerals going in as well. Is that about what you would let them have for hydration?
I don't know. Yeah. I just don't know the answer to that. And I don't think of it that way.
Well, I know the Mayo Clinic did some studies, and they said the minimum requirement for water every day is a half an ounce per pound of body weight a day. So if you weighed 128 pounds, that would be half a gallon of water a day.
Well, that's about right, yeah.
Yeah. Well, awesome. Thank you so much for the information that you shared with the audience today. And you can find you on your YouTube channel. We let the audience know what that channel is.
It's Agape Nutrition.
Awesome. Cool. Well, thank you. If you have any questions, feel free to reach out to us, and we'll see you in the next video.